All right, in this video, we're going to talk about how to mobilize the cuboid from an anterior to posterior standpoint. And oftentimes the people that need this are people that are relatively either in a truly pronated position, and you could see how this cuboid would need to go relatively down in order to be in a more efficient position, or the people that are a compensated supinated foot. Same thing applies. They're kind of stuck relatively in this position, and they need the ability for that cuboid to drop down. So how do we do this? I have the foot pre-positioned very similarly to, or the same as when we wind up cuboid or cuneiforms. Gotta get my words down here. So heels slightly lateral, right? And then the base of the first ray is slightly medial. Now I have her pre-positioned in a good position. Now I want to increase the barrier of that cuboid, right? In order to do that, I want it to actually come further up into a dysfunctional position. So I'm going to wind up into, you could call this external rotation, I guess, and just feel for when that starts to tighten up. And it's right about there. I want to make sure that I'm not overly stressing her knee. Is that okay? Okay, so now we're here. And now if I am localizing that cuboid, I can feel the base of her fifth ray, and then I can come a little bit proximal and then a little bit superior, okay? Proximal, superior, right there, I'm on cuboid. Okay, so that's just an easy way to kind of find that. And then from there, I can feel just on different angles, where does it feel like it's stiff? And right there it feels like it's stiff, and I'm actually having to kind of scoop down a little bit with her. And that may not be what you have to do, but I'm kind of scooping down a little bit. So I have just taking up the slack into that infield. I have her foot localized out to bring that engaged. Now the last little step here is if I bring her knee across, you can imagine how that would further want to bring that foot up, okay? So I'm going to take up the slack, and I'm going to feel as I bring her knee across right there, I start to get an infill into my treatment finger, into my index finger here. And now from here, my mobilization is this, okay? So I'm getting a tractioning through my assisting hand as I'm just engaging a little bit more to maintain that block on the cuboid, okay? So if we go back through, I'm here, I have her foot in a neutral position. I take it into a little external rotation there. I find the cuboid, base of the fifth, come proximal, come medial a little bit. I'm on it there. I localize. I bring her knee across to further localize. And then in order to treat, I'm tractioning up as I engage my treatment finger down. Okay? So that is, and then you can continue to do that until either it feels better or you're just not getting anywhere. That is treatment anterior to posterior on the cuboid.